Hello everybody, and welcome to the Thursday edition of Video Clips, and I'm going to start with something I discovered in my archives. You probably have heard that the Trump administration is prohibiting, in the process of prohibiting the use of flavored e-cigarettes in particular, because of some of the problems, which I'll come back to. But as it turns out, in 2016, I wrote an article on this that predicted that this is what was going to happen. I'm just going to share a couple of excerpts from it before I get to the topic for today. So some researchers have reported that the concentrations of many chemicals in vapor is less than the concentration in conventional cigarettes, but there's no research at this time, this was back in 2016, that shows that this lower concentration actually results in improved health outcomes. One research group actually stated that electronic cigarettes are not a smoking cessation product and they're unsafe and hazardous to health. The group reported significant side effects from use, which included nausea, vomiting, headache, dizziness, choking, burn injuries, upper respiratory tract infection, dry cough, dryness of the eyes and mucous membranes, release of cytokines and pro-inflammatory mediators, allergic airway inflammation, decreased exhaled nitric oxide synthesis in the lungs, change in bronchial gene expression, and risk of lung cancer. Well, the reason why we're having this discussion is because, as it turns out, now that these e-cigarettes are being used widely in the population, this is exactly what we're seeing. And we've had 6 deaths and 500 reports of these kinds of things, over 500, just in the last few weeks. So having said that, and this is my article again from 2016, some advocates still insist that e-cigarettes help people to quit smoking, but one study showed that the use of the products by adolescents and young adults was associated with progressing to smoking conventional cigarettes. In other words, instead of being a substitute, it actually ended up being a gateway. Again, back in 2016 is when I wrote this. And a meta-analysis of 38 studies showed that the odds of quitting smoking were 28% lower for adults who used e-cigarettes compared with those who did not, and this result was not affected by the level of interest in quitting smoking. The analysis is consistent with other studies that have reported the same results. So yesterday, and let's see what today is, I guess it was September 11th. I should have been able to remember that, right? The Trump administration said it was going to ban the sale of most flavored e-cigarettes in response to recent reports of over 500 cases of harm and respiratory illness and 6 deaths that are related to these very unsafe products. It is estimated right now that 25% of high school students have used e-cigarettes, and part of what makes it so appealing to kids is the mango flavor and the mint flavor and all that sort of thing. If it tasted like tobacco product, I don't think it would be quite as appealing to adolescents. The FDA sent a warning letter Monday of this week to Juul, the biggest manufacturer of these products, stating that the company was violating the FTC regulations concerning advertising by claiming that vaping is healthier than cigarettes, and it's clearly not. So that's a false claim that the company has made and been making for quite a long time. While e-cigarettes will still be available, removing the flavored ones will make them less attractive and enticing to kids. And if we stop making the claim that if you're a cigarette smoker, this is going to help you quit, and it's safer to do this than to smoke cigarettes, that will dry up some of the demand for them too. I have friends who use these things because they have bought the idea that they're safer than regular cigarettes, when that is clearly not the case. All right, so the topic for today is drugs and supplements and health conditions that can affect thyroid tests and function. And what inspired me to do this is I've received several emails, and when I get a bunch of emails on something, it tells me I should probably be talking about it. I've received several emails from people who say, gosh, it seems like the incidence of hypothyroidism is going up. Everybody I talk to is taking thyroid medication. What's up? So I'll just start at the beginning. I have a lot of information to share. This is a bit of a long article, and it has a lot of references. And by the way, if you want to read this original 2016 article that I did on e-cigarettes, it's posted in our library, and if you're a member, you have a passcode to get into that. All right, so here it goes. One of the downsides of regular and frequent doctor visits is regular and frequent tests of all types, and the more tests you perform, the more likely you are to find some type of abnormality. This is particularly true when you run blood tests. Now, doctors generally consider abnormalities to be new conditions requiring treatment, Rarely do they look at health conditions and drugs and supplements as potentially causing abnormalities, and blood tests that should be considered too. Medical doctors often take a very dim look at supplements, which means they don't ask about them, and then people know that doctors are often sort of hostile to the idea, so they don't disclose to their doctors that they're taking supplements. And so this leads to people making decisions, including doctors, without all the information. Not a good idea, but in any case, one of the ways people get sucked into the medical mill is abnormalities and blood tests, and that certainly happens with thyroid. So taking tests for thyroid disease used to be performed only when a person had symptoms that were suggesting that the person probably had a problem with their thyroid, but now tests are included in many, if not most, routine blood tests, and as a result, the diagnosis of thyroid disease has increased during the last several years. One reason is disease mongering. And what I mean by that is if you keep ratcheting down the threshold for diagnosis for thyroid disease or anything else, you're going to have more people who qualify for drug treatment. So the drug companies like when this happens, but it's not particularly good for the public. The other reason is that we're seeing so many diagnoses is that there are so many drugs and supplements that affect thyroid function and test results. So I've got a long list of things to tell you here. The first one is a lot of people who take supplemental iodine are doing so to prevent hypothyroidism or for the treatment of it and the treatment of the fake disease subclinical hypothyroidism. Now, I've written about this subclinical hypothyroidism thing. There's an article in the Health Brace Library about it. If you remember, you can go there and read it. I won't regurgitate all that here. But the point is, taking supplemental iodine, particularly in high doses, can reduce or even turn off the production of thyroid hormone. Eating foods like sea vegetables on a regular basis is particularly problematic, particularly kelp, because sea vegetables, especially kelp, have really high iodine content. In Japan, iodine-induced goiter is in Japan very common as a result of the regular consumption of sea vegetables, and often is reversed when seaweed consumption is reduced in the diet. Even the contrast dyes that contain iodine for CT scans can have a negative effect on thyroid function temporarily. High iodine intake has been associated with increased risk of autoimmune hypothyroidism, and people who have already started producing antithyroid antibodies are at particularly higher risk of developing thyroid disease when iodine intake is high. So the first thing is if you've had a routine blood test and somebody's telling you that you potentially have or do have hypothyroidism, the first thing you want to ask yourself is, are you eating iodine-rich foods or taking iodine supplements? Amiodarone is an antiarrhythmic drug which contains iodine. Just one 200 milligram tablet, which is the standard daily dose, contains 45 times the recommended daily intake for iodine. The drug can cause both hyper and hypothyroidism. In addition to its iodine content, amiodarone can interfere with the action of thyroid function by reducing the conversion of T4 to T3, which is the usable form of thyroid hormone. Lithium blocks the production of thyroid hormone, and it's estimated that about 17% of all patients who take lithium will develop hypothyroidism. Estrogen increases circulating levels of thyroxine-binding globulin, which decreases thyroid hormone levels and thus affects thyroid function. Taking oral contraceptives can suppress thyroid levels and function, as can taking hormone replacement therapy after menopause. Women who have high estrogen levels due to their diet, lifestyle habits, and/or health status also are at risk of this happening too. Proton pump inhibitors, very popular drugs, can contribute to hypothyroidism by reducing acid to the point where thyroid medications are not absorbed properly after being broken down. Other drugs that interfere with the absorption of thyroid hormone include bile acid sequestrants, Cipro, antibiotic, statin drugs, and raloxifene. Iron supplements and calcium carbonate can block the absorption and also of thyroid hormone and increase TSH levels. Biotin is a supplement that is commonly taken to promote hair growth, and taking it can result in a false diagnosis, particularly of hyperthyroidism. So patients should be aware of this, and if you know that you're going to have a blood test, stop taking biotin a few days before so that you get an accurate test result. Seizure drugs like Tegretol and Dilantin can interfere with thyroid tests and decrease thyroid hormone levels, and anticoagulants like heparin can have the same effect. Patients need to know about the potential for food, supplements, and drugs to cause and exacerbate thyroid disease and to affect blood tests. Not knowing can result in a couple of bad things happening. One is an continually increasing levels of thyroid hormone being required, and the other is starting to take thyroid hormone if you stop taking a drug or supplement or eating a food, you might not really have hypothyroidism and don't need to be medicated. Better to stop the iodine supplements, the PPIs, the iron and calcium supplements, the HRT, the oral contraceptives, whatever it is that is interfering with proper thyroid function or accurate tests. Doctors need to be really conservative about this, and they're probably not going to be, which is why you need to be aware of this before you have a blood test and pay attention to what I'm telling you. The reason is that once a person starts taking thyroid medication, the longer you take it, the less likely you are to ever be able to stop taking it. And so it should be a really well-considered decision, and particularly since there's a risk of people who don't have hypothyroidism starting to take medication, because I've met many people over the years that didn't have hypothyroidism when they started taking medication, but after 20 years they certainly have it, and the likelihood that they're going to be able to discontinue the medication, not so good. So in fact, it is estimated that at this point in time there are 1.6 million Americans who are taking thyroid medication. That's probably a conservative number in my opinion, who are most likely being harmed rather than benefiting from being treated. So the messages here that I want to leave you with are, first of all, be cautious about how much time you spend hanging around with doctors. The more you do this, the more tests you have, the more likely you are to have something happen, which includes overdiagnosis, overtreatment. The other thing is, with thyroid tests, there are a lot of things that can suppress thyroid function that you can stop doing and restore thyroid function. There are a lot of things that can interfere with test results that you can also make adjustments for too. So that's it for today. As usual, if you're not a subscriber, hit the subscriber button, pass this on to anybody who you think would enjoy watching it, and I'll be back to you next week with more news. And by the way, don't forget about our Breast Cancer Awareness Month promotion. So spread the word on that and send me an email at pampopper@msn.com. Have a great rest of your week.